All right, so I see our panel. So we'll start with Megan.
Awesome.
Now, there we are. Great. Okay, Megan, and then Kavita, you can introduce yourselves, and then we'll start.
Awesome. Neal, it is such an honor to be here, and it's a delight to be here with all of you. I really appreciate it from truly the bottom of my heart. As an emergency physician who got introduced to EM through ER, I appreciate being here with all of you today. So I'm a ER doc at Brown University in Rhode Island. I'm also a public health researcher, and I'm one of the co-founders of GetUsPPE, which is a grassroots coalition of physicians, nurses, software developers, med students, and concerned Americans from across the country who are trying to get protective equipment in the hands of people that need it. It kind of came together because just like all of us on this march today, we were not willing to wait and see our colleagues put at risk. We're certainly excited to be here to try to advocate for more action on the part of the government, but in the meantime, we can't stand by and sit on our hands. We have to do something to protect ourselves and our friends. So truly honored to be here to talk about what we're seeing on the front lines and hopefully to get more PPE made and in the hands of not just docs and nurses, but our housekeeping staff, our EMS colleagues, and of course, all of the other essential frontline workers who keep our country running, many of whom are not in healthcare.
Thanks. Next is Sanjeev.
Hi, my name is Sanjeev Sriram. I'm a pediatrician in the Washington, D.C. area. I'm actually in clinic today, so I've been fortunate with my clinic schedule to get this time to join everyone between patients, and I really appreciate the opportunity to talk about my initiative with some other friends called Masks for America. We teamed up. It's me, a pediatrician, a teacher, Bob Bland, the co-founder of the Women's March, who's also an expert in sustainable supply chains, and Edgardo Miranda Rodriguez, who is a renowned Puerto Rican comic book illustrator. We got together and created Masks for America about a month ago, and in that month, we've seen 100,000 masks get distributed to New York, Puerto Rico, Detroit, New Orleans, and the DC area. So we're making sure masks get to where they need to using an all-volunteer force. And so from our FDA-certified manufacturer in China to all of our distributors and shipping, every single person involved in this initiative is doing so on a purely volunteer basis. So that means that every single dollar of every single donation is going strictly to making sure those masks get to the people who need them most.
Great, thanks. Kavita Patel. We had Kavita, and then we lost her, I think. Well, we'll introduce Kavita again when she pops back up. So we'll just start with the questions. So our first question is really getting to the heart of the mask issue and the shortages, which is, what does this shortage say about health access and inequities, and also about disparities? What is it revealing to the two of you, not just in terms of healthcare providers having masks, but in general, those who, what do the masks say about who gets them and who doesn't? So we'll start with Megan.
So the lack of masks and the lack of protection equipment strikes me as just the most deep comment on what we value in American society. So first, we as healthcare providers, again, I'm a doctor, but my entire team are expected to and are dedicated to going out there and saving lives. But we're expected to do that without the protective equipment to keep ourselves safe. And then, of course, our families as well, because if we bring the disease home, we then get our families sick. So it first shows the lack of respect for those frontline healthcare providers across the United States. Healthcare is a business right now, and it operates in a just-in-time model. I know that others are going to talk about the supply chain, but the fact that we don't have masks and that no one has stepped up to say we are going to provide these essential supplies says that people don't actually care about the fact that we're out there providing care. We're labeled heroes, we're labeled frontline troops. You would never send troops to battle without body armor. It is also horrific because, you know, we could activate the DPA for meatpacking plants, but we can't give the people that work there adequate PPE. And it is our frontline essential workers, again, not just healthcare, but the folks that are part of our food supply chain, our bus drivers, our post office workers, the pharmacy staff, the people who don't have the choice to stay home, who are primarily minority or lower income, who are being exposed and are being asked to use homemade solutions instead of things that can actually protect them. So to me, it is just this pandemic has made bare all of the inequities in American society and the degree to which we are very happy to sweep under the rug and let other people die the issues that are affecting us, and to activate governmental action only when it threatens our own ability to get food.
Great points. So it's not just about healthcare workers because they're on the front line and being exposed, but it's all the other people, as you just said, who often are lower income, who also are exposed and at great cost without any access. So masks are a major sort of revealing way to talk about the inequalities that we're seeing. Sanjeev, I know you have ideas about this too and thoughts.
Yeah, you know, one of the things about, and I think Megan, you know, alluded to this, is that we shouldn't have to be doing this. It's not that the American healthcare system doesn't have enough money. It's not that we are not doing enough in terms of money when it comes to healthcare. We spend more on healthcare than any other wealthy country in the history of the world on the face of this planet. And for people to have to do this kind of effort just to get the most basic scientific protection that we have, like, we're not doing, like, this is not a moonshot. This is like literally, like, I mean, like old technology of like getting a mask to protect healthcare workers. And as Megan was saying, you know, everybody who is part of our public health fabric. You know, I think that one of the things that we have to understand about this pandemic is that a grocery store worker, a delivery truck driver who's, you know, bringing prescriptions home to senior citizens and our disabled brethren, those are all people who are very much part of our public health fabric. None of us can be healthy unless every single person who is part of that fabric has the protection that they need to do their job. And while I am very empathetic to, you know, the economic hardships that the coronavirus has put upon all of us, I really have to ask, who are we making this economy work for when we are so desperate to reopen things? Who is it that we're really trying to restore a boom to, if it's not like all of us regular people who are trying to raise families and achieve our highest potential?
Thanks. So, you know, that raises the point that we're, you know, in many states reopening, and yet, again, masks are in the forefront. Will they have access to masks? So people, so please talk about this notion of who's having to work, who's not, and who, you know, who's not having to work. Who can, I mean, out in the field, people who are typically higher income who can work at home and they don't need the masks. So again, it's revealing this issue of those who need the masks and can't get them have to go out now in many states, and they're just really heartbreaking stories of people trying to decide, do I go back out to work again and possibly contract COVID-19 and bring it back to a family member who has health issues? So we're putting people who absolutely need their income in a terrible position without these masks. Again, masks. So what do you think about what the CDC and OSHA could be doing in terms of masks? Because I think, you know, we're seeing the CDC recently diluting their recommendations. We saw them make very strong recommendations to the meatpacking company in Greeley, Colorado. And then we saw 2 days later that they really made it sort of optional. So what are your thoughts now about what the CDC and OSHA should be doing in terms of masks, and how the two of you make sure, I know Sanjeev in particular, make sure that your masks are protective, and what quality control do you have? So we'll start with Sanjeev first, and then we'll go to Megan.
Yeah, so one of the earlier points that you made is that, you know, the sheltering in place is unfortunately very much an economic luxury. It's not public health advice that everybody is able to follow equally. Right now, I think the last statistic that I saw about the labor force was that only about 30% of America's workers could actually do their full, complete jobs from home. And when it comes to the Black and Latinx communities, 1 in 5 Black workers is able to work from home. Only, I think, about 1 in 6 Latinx workers is able to work from home. And so we have entire communities who their work has been deemed essential, but their lives are being treated like they're expendable. And so we need to have the kind of understanding that when the CDC gives guidelines, when OSHA gives guidelines, that is not to be politically tampered with, that it needs to be the kind of advice that the goal of which is to save lives. It isn't to maximize profits. It isn't to exploit work that is being done by people who have no other choice, but it has to be done in the interest of public health. And I think that where we have really seen the CDC fall short is that they seem to have listened very closely to lobbyists. The National Nurses United have pointed out that the American profit-driven private hospitals have, forced the CDC or pushed the CDC to lower the recommendations and standards for masks in hospitals. And in those situations, it is putting nurses, it is putting custodial staff, physicians, all of us at risk when we're getting muddled, messaging about what kind of masks are actually going to do the job and protect us, so that we don't have to worry about that. When I see patients, I want them to know that I'm not worried about me getting infected. My focus is on their health. My focus and all of my attention is not about, am I bringing the hazards of my workplace home to my kid? No, I'm not worried about any of that. I'm not worried about my physical health. My priorities and focus is all about my patients. But I can't do that if I have to second guess, is the mask that I've been told that I'm wearing, is this the right one? Is it going to protect me? Am I okay really reusing this thing between patients? All of that doubt is actually so dangerous for public health. And we need the CDC and OSHA to just offer clarity for the purpose of public health and not for politics or profiteering.
Megan.
Yeah, so I'm going to highlight a few things. So the first is, the fact is that there simply is not enough personal protective equipment in the United States right now. So not just N95 respirators and surgical masks, but also isolation gowns, gloves, hand sanitizer, the PDI wipes that we use to wipe down equipment and rooms in between patients. Those are all in unbelievably short supply. What we have seen is that some states and some hospital systems that have great leadership have been able to either stockpile in advance. My own hospital system knew there would be a pandemic someday. We had some financial capacity, so we had a large stockpile of masks that we were able to use in the early days. And then my governor has been effective in trying to procure supplies from other countries and from across our own country. We've seen similar things in Maryland and in some other states as well, where political leadership has been strong and has helped to protect both frontline healthcare workers and other essential staff. However, across the United States, we find that most healthcare facilities are not able to procure adequate PPE. It is a black market, cash-only business right now. At GetUsPPE.org, we're focused on donations because we recognize that most safety net hospitals, nursing homes, skilled nursing facilities don't have the ability to purchase these protective equipment on their own. Of the people, the 8,000 plus facilities that have put demand into our database, only about 20% are acute care hospitals. 80% are those other types of healthcare facilities. And again, when you talk about inequities in our society, look at our certified nursing assistants, our techs, right? The cleaning staff, the people that are working in these nursing home and SNFs that are the hotbeds of COVID-19 infection across the United States. If we don't have the supplies to give them adequate PPE, this infection is going to continue to multiply and spread. So we're trying to very much focus on those groups. So yes, acute care hospitals need high standard PPE, but so do our workers in healthcare facilities that are less acute care. And honestly, so do our prisons, our group homes, right? All these places where we have large collections of people living together. Regarding the CDC guidelines, I don't envy them right now. They are in the midst of not enough PPE, B, trying to provide some sort of scientific guidelines when we don't even know how this virus is transmitted. Is it droplet or aerosol, right? And then they're caught in a dysfunctional political system. I wouldn't blame the CDC for the conflicting guidelines because they're trying to do their best. But what I would blame is the lack of united federal effort to increase production and equitable distribution of protective equipment to frontline healthcare workers and other essential workers across the country. That is a non-negotiable. If we don't have that, we're going to have to come up with these stopgap measures because there's nothing else that we can do. And it is a travesty that this is where we are.
So I think, thank you so much, both of you. I'm that we lost Kavita Patel. You can watch her on MSNBC as well. Really what you've shown us, and I'm very grateful to the two of you, is that masks really unmask the social inequities, the access to healthcare, who gets them, who doesn't, the terrible decisions that people who are going back into the cities, into the workplace are facing now, whether to bring a virus home to family members or risk not being able to pay the rent. We're at a very, very tough time, probably the toughest I've seen in my lifetime. And it can be the time, as you're saying, for change too. We have unmasked many problems in our social structure that have been there all along, but the pandemic has shed light on them. And now it's up to all of us to really step forward, talk about them, and tell our stories. So thank you two very much for your participation. And we're going to move on to Jonas there. Thanks.